I'm Amanda Berman. I'm the director of the Red Hook Community Justice Center, which is a community court located in Brooklyn, New York. And we take a problem-solving approach to justice by working with our community to identify their needs, their priorities, and then working to develop solutions that help to reduce the use of incarceration and to empower our community and to enhance access to justice. Well, the most prominent change, like most of the world, has been our shift to remote operations when our building was forced to temporarily close in March of this year. And as a community court, we were fortunate because we already had the infrastructure in place to connect with our community outside of the courtroom and to continue that work and build on that work. So at first, much of our focus was really on outreach and wellness checks, just making sure that our community members were safe and healthy and that they had any emergency needs met. And it was also important to us that everybody knew that we were still there for them, even if our doors were closed. Um, Eventually, we were able to build out our virtual court operations and robust virtual programming. And we also began to resume outdoor community events. And we were also, this past summer, able to reopen our neighborhood office, which is a small satellite space that we have outside of the courthouse, which has allowed us to resume some in-person work as well. So we've been able to adapt in many ways, but I think that the one thing that's still missing is that function of a drop-in sort of community center where on any given day, people are dropping in to check in with their case manager or to seek out services or sign up for an after-school program. And that informality has played a really important role in our relationship with the community. So we miss that as our doors have been closed, and we look forward to getting back to that hopefully soon. So for starters, there have been the most concrete and direct impacts that we've seen, like the financial impact. Many people that we work with have experienced loss of employment or reduced income. And then, of course, unfortunately, many people have gotten sick. Many people have lost family members, have lost loved ones. And we know that lower income communities and communities of color have been disproportionately affected by the pandemic, and Red Hook is no exception to that. And then there's also the serious but sometimes less visible impact of the stress that's been caused or exacerbated by the pandemic. So we're seeing rising tensions at home due to stress, especially in families who are living in small spaces and sharing that space with one another more than they ever have before. And we're seeing more family conflict, domestic violence incidents. And then our clients who have histories of substance use or mental health issues or trauma, those clients are more vulnerable to a lot of the stressors that they're experiencing now. So in some cases, it has triggered relapse or bumps in the road for them, and our staff is trying to support them in any way they can. One of the most positive outcomes of the pandemic, I would say, has been our ability to offer more flexibility to meet the needs of our clients, whether in terms of the method of service delivery or timing and scheduling. When we were working in person, we were limited to a large extent by the hours of our building, and we couldn't offer the same level of flexibility that we can now. So if that means doing an intake session or a case management session with someone in their home over the phone or over Zoom, we can do that now without a problem, at 6 o'clock in the evening to accommodate someone's work schedule or childcare needs. And we found that this is improving compliance and improving outcomes for our clients. And it also signals to them that we recognize that our clients have obligations and lives outside of this case, and that those are just as important, or in some cases more important, than the case that they're dealing with in our court. Well, I think that we've learned we can accomplish a lot more remotely than we ever thought possible. And that should continue to be available as an option in the appropriate situations. So for example, where a client is doing well in treatment and typically they would return to court for an in-person compliance date, those can be virtual if the client is doing well and that better suits their needs, especially if they're in, say, a residential setting. We don't necessarily want to pull them out and bring them to court. Or if someone has life circumstances that make it difficult for them to come in person, whether for services or a court appearance, there's travel barriers. Sometimes someone doesn't have the money to get a Metro card, or scheduling barriers and they have to take off work. So I think we need to continue to offer those remote possibilities where we believe that it can be just as effective as in person. And giving more options and more flexibility removes a lot of the stress that the court process can cause in people's lives. And also along the lines of flexibility, we've been making a lot more use of our neighborhood office, as I mentioned earlier, which is located in a converted apartment in the public housing development that we serve in Red Hook. And so we've been expanding the range of services that we offer there. And we've learned that offering that access point outside of the courthouse brings so much value and peace of mind to the residents. And that's something that we really want to continue to prioritize even after we reopen our main building. Well, of course, first and foremost, we hope that the pandemic is under control and our communities are safe and healthy, and our staff as well. We certainly hope that we can reopen our doors, at least to some capacity, so that we can accommodate more people who do need that in-person work or who might benefit from that face-to-face interaction with our judge or our program staff. We are very concerned about the potential flood of evictions that our residents face in Red Hook. The majority of our residents, around 6,500 people, live in public housing. And those eviction cases that do get filed come through our court because we have a housing court as well as a criminal court and a family court. And New York State has had an eviction moratorium in effect, and it will remain in effect through the end of the year. But what happens after that is potentially catastrophic for the families who have been unable to pay their rent because of the economic impacts of the pandemic. So whether it's an extension of the moratorium or some kind of rent forgiveness, we're hoping to see some kind of long-term relief for the residents we work with. And then lastly, like most nonprofits, we face uncertainty with respect to funding and the anticipated budget cuts from the state and local levels. And we've been incredibly fortunate these past few months as we've had some private funders and other partners who've stepped up to offer their support, which has been tremendously helpful. But at this point, we just don't know how dramatic the impending cuts will be in the coming year. So we will remain hopeful that there will be other funding sources available to fill some of those gaps that may arise.